Hi friends, today I present a topic very relevant to our lifestyles: mobile, PlayStation, computer addiction. We as adults are so much dependent on these gadgets. We are so addicted to these gadgets as adults. We would not hesitate to introduce this gadget for a temporary distraction of even the newborn or a days or months old child, infant. So, as the child grows, my concern is here. Adults are also having increased incidence of disc degeneration due to bad postures. But in a child and a growing spine, vertebral column as it is growing, if you subject it to abnormal forces, like for example a person who's sitting like this, a person who's always on the computer, see this posture, the neck is flexed, the dorsal spine is flexed, the lumbar spine is flexed. So it's like a increased C. So all the lordotic curves, the lordosis is the backward curve of the cervical spine, the lumbar spine, they're all lost, and the increased pressure in the front will lead to formation of the bones itself as a V. The square shape is lost, the anterior heights are lost, and consequently they develop severe disc problems. First there will be a postural change, spasm, excessive relaxation of the posterior structures, excessive contraction of the anterior structures, degeneration of the disc at various levels, leading to nerve root entrapment or pincing, causing the patient very early in life to complain to their parents, "Mama, fingers are becoming numb, no mama. I'm having shock like things, mama." Why? Why is the boy or the girl complaining? Because it's too much of radiation. He may have headaches, memory loss. They're all well known to all of us. So I would like to quote two cases recently whom I have been treating. First child was brought to me with severe spasm. The head was tilted to the right. And when I asked the parent, did the boy fall? Did they have sometimes tonsillitis or some other upper respiratory tract infections can cause this wry neck, eustachian tube problems? He said, no sir, nothing. He just was playing with his PlayStation. And like this, he slept off. And by morning, when he woke up, he was having severe pain. He couldn't even talk or even just get up. So I admitted him, gave him some intravenous painkillers for a child and a physiotherapy, and he became normal. Then I educated the father and the child. You want this to progress? See the X-ray. X-ray shows a bent cervical spine. Scoliosis is developing. If you keep on leaving it like this and doing what you're doing, it will lead to irreversible permanent changes in the development of the cervical body. Half will be less shape, half will be of a different height, leading to a lot of problems. Even the small arterial holes, there will be holes in the body of the cervical vertebra. Vertebral artery branches to go to the brain, and if they are kinked on one side, it may lead to syncopal attacks, dizziness, and lot many more problems. So it may lead to weakness of all the four limbs. So when I explained all this to the parent was very happy. Child was angry, normal reactions. And then I moved on to show the MRI also. MRI of this child in the upper cervical vertebrae was showing bulges already. He is just 14-15 years old, while the lower cervical vertebrae were normal, meaning the stress was more on the upper cervical vertebrae. Flexion, acute flexion and prolonged keep on habitual, it's an addictive posture. So unless we wean ourselves, and also we see even the adults, walking along zebra lines with a cell phone. There are cars and scooters, buses waiting for them to clear the zebra crossing, but they take they're in their own world. So this is a very dangerous situation we are all coming to. Now the second case I will talk about is again a 14 to 16 years age group male who was bought with a history of severe low backache. of 9 months. He was seen by many orthopedic surgeons, spine surgeons, and of them 2 advised spine surgery for him, and I was one of them. His mother was not convinced. She said, Doctor, are you sure? Then I said, I took the textbook out, his symptoms, weakness in the left knee. I showed her. See the innervation of the left knee, L3, L4. Boy has L3, L4 disc. It's a weakness of the left knee. He has thinning of the muscles. I again showed her the innervation. Then I showed her the physical examination. He was not able to lift the leg. Straight leg raising test is positive. The reflex, ankle reflex is getting decreased, which means these symptoms which we can see in old group like my age. I'm 52 years. So if I have it, it's okay. What about a child of 16 years? He should not have it. And it's very sad for me because I know what is going to happen as the boy grows up. I know. Parents do not know. Most of the people do not know. Even the adolescents or the adults, even the senior people, they are addicts and they don't know what's going to happen to them. But they will all come up with severe nerve entrapment problems. And that's the reason I will say disc degeneration, vertebral body malformation, and other nerve root entrapment can all result in lot of havoc. So kindly don't become addicts. If you have already become addict, don't make your children addicts. If they have already become addicts, the whole family must wean away from cell phone usage or playstations. There's so many other things to do in life. Book reading, sports, outside world is so much. The outside world is calling all of us, but unfortunately none of us today are willing to move out of our door. That's the main problem. We all like indoors, and that's why vitamin D deficiency, no sunlight exposure on the skin, we become weak, aging, all these things, because we are not getting connected to God, whatever religion we belong to. You go and live in the world atmosphere which God created, then we will be all right. If we create our own world away from God's world, how can He save us? So with this small message, take care of your kids. Don't make them become addicts and spoil their future. Because efficiency in life after 30 years is very important. 30 to 60 years, that's the most productive part of each person's life. If by the age they become 30 years, they may have whatever qualification they may have, big qualification. What's the use if the health is not there? If they want to use a computer and have fingers are becoming numb, or they want to do something, there's tennis elbow. If they want to do something, they start doing kata 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 kata. So massage parlors, all these things are not a solution. Preventive orthopedics is most important. I hope at least 10% of the viewers who are watching me today will understand the agony I have for this, and that's the reason I have chosen this preventive orthopedics topic. Prevent addiction of gadgets. Thank you.